Most people do not know about the potential side effects of an epidural. These side effects could be more dangerous than some realize. After learning about the side effects of an epidural, this should show you why it's in everyone's best interest to not get one. Thousands of women have given birth without an epidural. Although labor is very painful, most of it comes from the fear in the mind. I'm going to try to persuade you to not get an epidural. The epidural has many side effects that can potentially be very dangerous. Blood pressure can be affected by the epidural. Tina Cassidy, the author of Birth, explains this in her book. They are also more likely to have a drop in blood pressure, develop a fever, and have difficulty passing urine and so are regularly catheterized. A drop in blood pressure can result in lightheadedness and nausea. If the blood pressure drops too low, this can be life-threatening. A severe headache can happen, known as the epidural headache. Cassidy tells us the large needle that they had used allowed a small amount of spinal fluid to seep out of the dura, a thin membrane that surrounds the spinal cord and brain. When the fluid level drops, the brain can sag, pulling on connective tissue, the result, throbbing head pain. Karen Smith of Columbus, Mississippi, told me that her epidural headache lasted for 2 days and was one of her most painful experiences. The epidural headache can even last up to a week. The epidural may not work or only numb one side. Karen also told me that with her youngest child, the epidural only numbed the left side of her body. The American Pregnancy website says some women complain of being able to feel pain and or feeling that the drug worked better on one side of the body than the other. Heidi Murkoff and Sharon Mazel, the authors of What to Expect When You're Expecting, point out epidurals also might not offer complete pain control if you're experiencing back labor. So even with getting an epidural, you still might feel the pain. An epidural can also affect the baby. This can cause the baby's heartbeat to slow down. Murkoff and Mansell also say because an epidural is sometimes associated with the slowing of the fetal heartbeat, continuous fetal monitoring is usually required as well. It is hard to predict how it will affect the baby's heartbeat because everyone is different. Some babies have difficulty latching on after the mother is given an epidural. The American Pregnancy website says one possible side effect of the epidural with some babies is the struggle of latching and breastfeeding. This will make it more difficult on the mother if she was planning on breastfeeding. Breastfeeding is very important and beneficial to the baby, and getting an epidural could ruin this. The baby could have difficulties getting in position for delivery. If the epidural stops the baby from getting in position for delivery, this will result in an emergency cesarean. And if an emergency cesarean occurs because of an epidural, the recovery process will be longer and more painful. American Pregnancy website points out a baby might also become lethargic and have trouble getting in position for delivery. Respiratory depression could occur. Margot A. Hom, the author of Epidural Anesthesia Update, explains it is manifested by a decrease in the depth of respirations or tidal volume, followed later by a decrease in respiratory rate. Hom also points out the most serious narcotic-related side effect associated with epidural anesthesia is respiratory depression. This is a side effect that should be considered before receiving epidural because it can be very dangerous. This side effect can affect both the mother and the child. In conclusion, I hope that everyone will consider not getting an epidural. The mother could suffer from low blood pressure, severe headache, and the epidural not working. The baby could suffer from slow heartbeat, difficulties latching on, having trouble getting in position for delivery, and respiratory depression. Although some people think the pain is too much, I believe getting an epidural can be avoided. Other pain medication options are available that do not have as many and serious side effects. Also, once labor is over, the pain is gone. Thank you.